What's up, Jeff?
Hey, buddy, how are you?
Good. How you doing?
I'm hanging in there.
How's the shoulder treating you?
Not so hot, man. Not too good. Not too good.
All right. So why don't you tell the people what's been going on?
Well, about 2 weeks ago, I was diagnosed by Vin, my neighbor who's an athletic trainer. He diagnosed me with impingement syndrome, specifically of the supraspinatus tendon at its insertion point on the greater tubercle of the humerus.
He's a very smart patient.
I've been going to a physical therapist for about 2 weeks, and they've had me on a strengthening program, as a method to increase the muscles within my shoulder, and to help decrease the inflammation that's causing the impingement syndrome of the supraspinatus tendon. I'm having no success with it. It's just not gotten any better. It hasn't gotten any worse, but it's not gotten any better.
Yeah. So Jeff came to me after he's been going to physical therapy, and we've basically tried some of the stuff the physical therapist has been doing. Some stim to help with pain, specifically IFC. To really try and get in there. Jeff also, he's a humble guy. He graduated from NYU as a doctor, so it's easy to converse with him about this stuff. So nothing's really seemed to be working, and Jeff came to me today. So now we're just going to talk about some other treatments, and I've been looking up kinesio tape. You know anything about kinesio tape?
Not really, no.
Okay. So with kinesio tape, what it does is it basically just pulls the skin around wherever you're trying to get, and then so what kinesio tape does is it just puts stress on the skin, which then puts stress on the tissues underneath the skin and helps bring blood flow to the area. So what we're looking to do with Jeff here is kind of just help him with pain right now, and also he's helping with his scapular movements. That's also been helping and causing the pain with his impingement. So what it does with pain is you open up the lymph ducts after putting the stress on the tissue, and that helps to bring the blood flow out of the area, thus decreasing the inflammation. And also what we're looking to do with the tape is kind of just normalize his scapulohumeral rhythm by altering the scapular muscle activity and correcting any kind of abnormal movements. So Jeff also has an anterior tilt of his scapula. So what that does is it kind of compresses the subacromial space, thus making the symptoms even worse. So what we're looking to do with the tape today is kind of just give him more of a posterior tilt and help activate the lower trap a little bit more. This way he's not pulling all the stress on those muscles in his shoulder. So what's your main complaint, Jeff?
My main complaint, I have pain with kind of the late cocking phase of when I throw. Being in the outfield, I kind of have to make those long throws. But I'd say my main complaint is when I bring my arm up to the side. Usually when I get from like about right here to about right here, that's when I have the most pain. But up here is fine. Yeah.
Okay. So as you, Jeff, we saw a couple. I read a couple studies, and one of them says that the type of application that I want to do to you really helps with pain and abduction, and abduction is what you just did, as you know. So we're looking to do that and also help decrease the pressure with the tape. So are you comfortable with me doing a kinesio tape job on you?
Of course.
Have you ever done any kind of tape on yourself before? Did anyone ever do it to you?
No, never on my shoulder, no.
All right. So even though you went to med school, you really don't know about the tape, you know what I mean? So to help the adhesion between the tape and the skin better, we kind of warm up the tape, get the glue in there flowing, this way it doesn't come off when he's playing. Right now we're just looking to do it as a, just an everyday treatment while he's around the house or doing whatever he's doing, his daily activities. We could also do this while he's playing, but obviously he doesn't have a game tonight, so we're just going to try and see how this works right now. So the good thing about kinesio tape is there's really not that many risks, as opposed to like stim or ultrasound where you have to be worried about a couple different factors. Some things we think about or be cautious about is that it may not work immediately. Sometimes kinesio tape is used as a long-term treatment to kind of just help correct any abnormalities, which we're looking to do here, but hopefully we can get a immediate effect out of it. Some of the things could be him not really liking the tape, how it may feel on the skin and whatnot. Also, this isn't just a one fixed treatment. Along with all other modalities, you need to implement other things. So it's good that he's been doing the strengthening program. Hopefully the kinesio tape will help just put him over the edge to kind of get rid of that pain and, you know, fix what we've been talking about. And another thing, it's tough with kinesio tape because there's multiple techniques you can do. You know, there's a lot of research out there saying, you know, this technique is better than the other. So it's kind of just like a trial and error, see which one's the best and go with it and see which one works best for the patient. So, turn it on a little bit. So the first one I'm going to do is kind of apply it to the lower trap, just to kind of help bring the scapula into more of a posterior tilt. So, what's that? Yeah, can you take a show? Okay, so we're kind of just going to apply it up here, and then as you see I cut a couple different strips in here to try and fan it out as the trap kind of fans along the spine. So what you want to do is you first want to kind of apply with no tension, and then you could apply, and then you pull a little bit just to kind of recreate the, create the tissue stress up here or wherever you are applying it. So the kinesio tape definitely stretches, so you may need less than what you think you may need. So just be cautious of that when applying. You know, as athletic trainers, we usually have pretty good, clinical experience with taping, and we generally do it more, but plenty of other physicians and medical personnel use it, such as physical therapists. I'm sure you've talked about it with your physical therapist, and doctors use it as well. Teachers even use it. Okay, so I'm going to apply it up here on Jeff. Just have it stick, and I'm kind of just going to fan it out. Want to apply a little bit of tension, help just fan it out. So when you're applying the tension, in the research that I found, Jeff, you want to pull the tension with about 15 to 25% of what the full tension the tape could stretch. So, the tape could stretch this much, 15% would be like that much more of how much tension you want to pull on it.
Do you pull it in a certain direction, or do you just kind of pull any way that's comfortable for the patient?
Yeah, so you want to pull in the direction of the muscle that we're trying to get the tissue stress in. So in this case, the lower trap. So we're pulling from here down and then fanning it out where it inserts on the spine. So that'll kind of help get the whole muscle, and that's where the stress will be placed. So the next one we want to put on the supraspinatus. Again, he's been feeling some pain. He's also been having some weakness. So the next one we're going to do is we're going to apply it over the supraspinatus tendon. And again, just trying to recreate that stress where the muscle is, and also help bring out some of the swelling, as we mentioned before, that'll open up the lymph ducts for the swelling to kind of get out of there. So right here I'm going to put on the greater tubercle of the humerus and apply no tension here. We don't really want any tension there, but then when you're pulling after, you want to get tension along the supraspinatus muscle. And the last one we're going to do is over the deltoids. So, and then we're going to fan it around the deltoids. Again, just to have some more support in the shoulder, because he has been complaining of some weakness, and with this tape we're going to help just kind of help strengthen the muscle activity around the shoulder. So this would be a full kind of tape job using kinesio tape for his shoulder. Again, as we spoke, some not cautions, but some other things you would want to tell your patient is that they don't necessarily need all of this. It can be 2 out of the 3, 1 out of the 3, or those can be combined any which way you want. You can take out the supraspinatus one and just have the deltoid and the lower trap one, as we talked about. So this is what we got. So Jeff, let's try it out and see how it goes.